Welcome everyone to the Apothecary Tales, the basics of pharmacology. Today we're going to talk about one of the neurodegenerative disease and its treatment, that is Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disorder that destroys the memory and other important mental functions. And this Alzheimer's disease typically progresses slowly in three general stages, that is early, middle, or late stages. Since the Alzheimer's affects the people in different ways, each person may experience symptoms or progress through the stages differently. Now, talking about the first stage, that is the early stage Alzheimer's or the mild stage, what happens is that a person may function independently and he or she may still drive, work and be part of social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting familiar words or the location of everyday objects. The symptoms may not be widely apparent at this stage, but family and close friends may take notice and a doctor would be able to identify symptoms using certain diagnostic tools. So what are the common difficulties seen during the early stages? That coming up with the right word or name, remembering names when introduced to new people, having difficulty performing tasks in social or work settings, forgetting material that was just read, or losing or misplacing a valuable object, experiencing increased trouble with planning or organizing. So that is about the early stage. Now when moving on to the middle stage Alzheimer's condition, which is a moderate stage, typically this is the longer stage and can last for many years. As the disease progresses, the person with Alzheimer's will require a greater level of care. And during the middle stage of the Alzheimer's, the dementia symptoms are more pronounced and the person may confuse words, get frustrated or angry and act in unexpected ways such as refusing to bath, etc. Damage to the nerve cells in the brain can also make it difficult for the person to express thoughts and perform routine tasks without assistance. And symptoms which vary from person to person in the middle stage includes being forgetful of events or personal history, feeling moody or withdrawn, being unable to recall information, experiencing confusion about whether they are or what day it is, requiring help choosing proper clothing for the season or the occasion, having trouble controlling the bladder and bowels, experiencing changes in the sleep patterns, showing an increased tendency to wander and become lost, demonstrating personality and behavioral changes. And in the middle stage, the person living with Alzheimer's can still participate in daily activities with assistance. And it is important to find out what the person can still do or find ways to simplify the task. So as the disease progresses, moving on to the late stage where the dementia symptoms are very severe and individuals lose the ability to respond to their environment, to carry on a conversation and eventually to control the movement. They may still say words or phrases, but communicating pain becomes difficult. As memory and cognitive skills continue to worsen in the condition, significant personality changes may take place and individuals need the extensive care. So these are the different stages of the Alzheimer's disease. Now we have observed that dementia is one of the most common symptoms associated with the Alzheimer's disease. There are three distinguishing features of dementia. That is accumulation of the senile plaques, that is beta amyloid accumulations. So this senile plaques is nothing else but a complex comprising of the degenerative neural structures along with microglia and astrocytes. The next thing that we can observe with dementia is that formation of numerous neurofibrillary tangles. Then loss of cortical neurons, particularly the cholinergic neurons. So these are the different distinguishing features of the dementia of the Alzheimer's type. The current therapies aim to either improve the cholinergic transmission within the CNS or will prevent the excited toxic actions resulting from the overstimulation of the NMDA glutamate receptors in the selected areas of the brain. And the pharmacological intervention of the Alzheimer's disease is only palliative and provides modest short-term benefit, and none of the available therapeutic agents alter the underlying neurodegenerative processes. Now talking about the first class of drugs used for the treatment is acetylcholinesterase inhibitors. So there are numerous studies that have linked the progressive loss of cholinergic neurons and presumably cholinergic transmission within the cortex to the memory loss that is a hallmark symptom of the Alzheimer's disease. So it is assumed that the inhibition of the acetylcholinesterase enzyme within the CNS will improve the cholinergic transmission at least at those neurons that are still functioning. So what is the role of this acetylcholinesterase enzyme? This enzyme is responsible for the degradation of the acetylcholine that is present in the synapse. So when this inhibition occurs, more amount of acetylcholine is available at the postsynaptic membrane receptors to provide the action and thereby improve the cholinergic transmission. The reversible acetylcholinesterase inhibitors approved for the treatment of mild to moderate Alzheimer's disease include the donepezil, galantamine, and rivastigmine. All of them have some selectivity for the acetylcholinesterase in the CNS as compared to the periphery. Galantamine may also augment the action of acetylcholine at the nicotinic receptors in the CNS. At best, these compounds provide a modest reduction in the rate of loss of cognitive functioning in the Alzheimer's patients. Talking about the rivastigmine, it is the only agent approved for the management of dementia that has been associated with the Parkinson's disease and also the only acetylcholinesterase inhibitor available as a transdermal formulation. Rivastigmine is hydrolyzed by the acetylcholinesterase to a carbamylate metabolite and has no interactions with drugs that alter the activity of cytochrome P450 enzymes. Whereas the other agents are substrates for the cytochrome P450 and have a potential for such interactions. And the common adverse effects associated with these acetylcholinesterase inhibitors include the nausea, diarrhea, vomiting, anorexia, tremors, bradycardia, and muscle cramps. Next, moving on to the NMDA receptor antagonist. So the stimulation of the glutamate receptors in the CNS appears to be the critical for the formation of certain memories. However, the overstimulation of the glutamate receptors, particularly of the NMDA type, will lead to the excitotoxic effects on the neurons and is suggested for the mechanism for the neurodegenerative or the apoptotic processes. So what usually happens? Binding of glutamate to the NMDA receptor will lead to the opening of an ion channel that will cause the entry of calcium into the neuron. But whereas when there is an overstimulation, what happens? Excess amount of the calcium intracellular levels occur and will activate a number of processes that will ultimately damage the neurons and can lead to the apoptosis. This memedin is the NMDA receptor antagonist that helps block the NMDA receptor and thereby limiting the calcium influx into the neuron such that the toxic intracellular calcium levels are not being achieved. And this is indicated for the moderate to severe Alzheimer's disease. The memedin is well tolerated with few dose-dependent adverse events. The expected side effects include the confusion, agitation, and restlessness, which are indistinguishable from the symptoms of the Alzheimer's disease. Given its different mechanism of action and possible neuroprotective effects, memedin is often given in combination with an acetylcholinesterase inhibitor. So that is all about the treatment of Alzheimer's disease. So in this video, we have learned about what is Alzheimer's disease, different stages of Alzheimer's disease, and the two main classes of drugs that can be used for the treatment of Alzheimer's disease, which includes the acetylcholinesterase inhibitors and NMDA receptor antagonists. So I hope that it is clear for you. If there's any comments, suggestions, please do mail in us. Thank you.